voitures et maisons pour assurer la survie de nos familles. C'est la forêt et la terre. Missy est bon, elle est baillon, c'est ma eie. Missy bonne ni te ni, elle est baillon, c'est ma eie. Et ma coubasia n'a ton mambo manioko. Nabe café na biko konone, umo so mo sanga olia.
Toyanaka, obonongo, yosumise, inundanga, abonisa, sakonane.
Non à la vente des terres, non à la vente des terres, non à la vente des terres, non à la vente des terres,
Ah, beneni, bekime, ouanu tonelena, mokatu moti, usunu ni fola, abanisa, toyana kobonanga tobonanga salaba,
Toba munu moti, batakaka obusi.
élevons nos voix, chantons sur tous les toits, pour que demain soit plus clair. Si t'entends ma voix, la voix des sans-voix, ce qu'on a de plus cher, ce sont nos terres. Ce qu'on a de plus cher, ce sont nos terres. Toyanaka, obonongo, yosumise, inundanga, abonisa, sakonane.
non à la vente des terres, non à la vente des terres, non à la vente des terres, non à la vente des terres.
On peut tromper une partie du peuple tout le temps et tout le peuple une partie du temps. Mais on ne peut tromper tout le peuple tout le temps. Oui au développement, non à l'exode rural.
Diaspora Banen, chef traditionnel élite, fils et filles, que chacun apporte sa pierre à l'édifice. Mounani Moundamonte.
Non à la vente des terres, non à la vente des terres, non à la vente
Peuple Banen,
des terres,
tous nous sommes interpellés.
non à la vente
Soyons unis.
des terres, non à la vente
Bonani petit me patenem. Me katu motin fosini for lock.
non à la vente
Monani foyer moi.
non à la vente
Nous remercions le collectif des artistes Banen et son président, Monsieur Écombile Vincent Olivier, pour sa lutte acharnée pour le réveil de la culture Banen.
Nous disons stop à la vente de nos terres.
Jamais, ne cédons pas au chantage et belles paroles. L'héritage que nos ancêtres nous ont légué, c'est pas l'argent, les voitures et maisons. Pour assurer la survie de nos familles, c'est la forêt et la terre. Missy est bon, elle est baillon c'est ma eie. Missy bonne ni te heni, elle est baillon c'est ma eie. Et ma kubasia na ton mambo manyoko. Be café na biko kono ne umo somo sanga ulia
Toyanaka obonongo yosumise imundanga abonisa sakonane.
Non à la vente des terres, non à la vente des terres, non à la vente des terres, non à la vente des terres.
Abeneni bekime uwanu tonelena mokatu moti usunu ni fala abenisa tuyana kobonanga tobonanga salaba
Tobe munu moti bakakaka obusi.
Élevons nos voix, chantons sur tous les toits, pour que demain soit plus clair. Si t'entends ma voix, la voix des sans-voix, ce qu'on a de plus cher, ce sont nos terres. Ce qu'on a de plus cher, ce sont nos terres.
Toyanaka obonongo yosumise imundanga abonisa sakonane.
Non à la vente des terres, non à la vente des terres, non à la vente des terres, non à la vente des terres.
On peut tromper une partie du peuple tout le temps et tout le peuple une partie du temps. Mais on ne peut tromper tout le peuple tout le temps. Oui au développement, non à l'exode rural.
Diaspora Banen, chef traditionnel élite, fils et filles, que chacun apporte sa pierre à l'édifice. Mouna ni mouna monté.
Non à la vente des terres, non à la vente des terres, non à la vente
Peuple Banen,
des terres,
tous nous sommes interpellés.
non à la vente
Soyons unis.
des terres, non à la vente
Bonani petit me patenem. Mokatu motin sosini folo. Monani foye mo.
non à la vente.
remercions le collectif des artistes de Banen et son président, Monsieur Écombile Vincent Olivier, pour sa lutte acharnée pour le réveil de la culture Banen.
Thank you very much, Alan. Good evening and welcome to this virtual discussions that is brought to you by Immigrant Community Services. In these discussions, we bring you virtual resources and information as our community deals with the COVID-19 pandemic. My name is Mankan Kimbeng and I'm honored to be your host this evening. I want to warmly welcome our special guest this evening, where we'll have Mr. Mayor Moody, Dr. Sonia Konate, and Nurse Aurelie Happy. And our series today has two segments. We'll begin by recognizing this week's local heroes, a segment where we highlight community members who are doing a great job during this pandemic. We're going to start with Mayor Moody, who is the Executive Director of American Diversity Group, and their group is their organization is actually leading the way in helping our community now. Then we'll speak to Dr. Sonia Konate and Aurelie Happy, who are actually on the front line right now. And we'll hear about their experiences and what it means to be a healthcare worker on the front lines of this pandemic. At the end, we hope our viewers will have a good understanding of kind of the sacrifices that healthcare workers are undergoing right now. And then you really understand why we think healthcare workers and people who are on the front line are actually our heroes today. So let's start with our first segment, this week's local heroes. So the local heroes are American Diversity Group, and they are a DC Metro nonprofit that is providing services to underserved communities, which are through free access to healthcare and clinics in the DC area. Since the COVID-19 pandemic started, they have been providing meals, groceries, and face masks to people in need in our community. And we all know that these are critical services for people who have lost their job. So we want to welcome you, Mr. Mayor, to this discussion. And can you please tell us a little bit more about American Diversity Group?
So, hello, thank you for letting me in today, Afriquetoday. Thank you for having me again at your show. And thank you, the immigrant community, also for having me on the show. So American Diversity Group was formed in 2013, and that was the reason we formed, is for giving out the people free healthcare. And we started that with one healthcare in 2013, and now in 2019 we ended up with doing almost 30 health fairs, and we are able to serve almost 7,000 people out in the community with free healthcare.
Wow.
And the healthcare that's been provided, it's really a comprehensive healthcare that what we have been doing out in the community. First, we do the labs. That's done on the first week. And once the labs have been drawn, the second week, the doctors read the results. And if there's any kind of abnormal values of the lab, the doctors make sure that they call the community folks right there and there on the day we get the result. That's next day, to make sure that they have been followed up right away, either in the ER or right away with one of the primary care doctors, or even with one of our doctors who could volunteer to see them. Because that's very important and very critical if the people's labs are high and abnormal, and they need to follow up. But once we are reviewing the labs with the regular people in the labs next week, we make sure that the labs are being reviewed if they have any chronic conditions and if they have no insurance. Those people are being made sure that they are being referred to the primary care provider or to the people who have no insurance. We make sure that we connect them to the safety net clinics for the uninsured. If not, then we make sure that the doctors take care of them for the follow-up visits.
Okay.
So it's like a kind of a continuity of care to the people when we identify people who do not have insurance. So main thing is the continuity of care to the people, make sure the chronic diseases are being completely managed. And we don't believe in number of people we serve. Like, as I said, that we served 7,000 people, but that's not important that we served 7,000. But from that 7,000 people, we identified almost 182 people who were really having a chronic conditions and had some kind of a diabetes or COPDs or heart failure or something. So those are the ones that I'm looking out for, not those 7,000. But once I did these events, I was able to identify from that 7,000 that where these people come from. And we make sure that those people are being followed up on a continuous basis with the primary care provider and also with the specialist.
Okay.
And if any procedures are to be done, like for instance, like, with a cardiologist kind of a stress test or echoes, other things, we make sure that that's being done either at low cost or no cost. So
that's amazing.
The main thing that's what American Diversity Group have been doing until now. But because of the COVID crisis, we had to end up doing those health fairs because it's kind of not possible.
Yeah.
So we ended up with telemedicine, and then we came up with the new concept of even doing the teledentistry and telenutrition.
Okay. So you guys have also now changed from just providing healthcare to also providing food and groceries, it seems.
Exactly. So what we thought that, we came across some people out in the community and they had no jobs, they have no money and also no insurance. But we can survive without the money, we can survive without the job, we can survive without the insurance. But what about the food? That's the basic necessity, right?
Yeah.
So like I can say that I have no money, I can still be at home without 7 days without my money. If I am sick, at least I can do some home remedies and be home at least for 7 days without being treated, or get more and more sick. But without food, it's difficult. And, and even like, the adults can at least be there for 1 or 2 days without food. What about the kids, at school, at home? Without food, they cannot, like the kids are at home, the people are not able to buy the food, they have no money, they have no money to get even small things for their kids, so that just triggered us to do something really big way. And we started in Howard County, and now we are here in Montgomery County as well.
Okay.
And last week we were able to give away almost 10,000 pounds of food to almost 1,000 individuals. And we did not say no to anybody. Some people said that I have a family who cannot drive. We gave away more food to them, so that way, that family can also get the food.
Okay.
And this Saturday, we are going to do it again, and we are going to give away almost 30,000 pounds of food to more than 1,000 people, and that would be produce and groceries.
Okay. So where are you getting the food from? I know you guys are primarily a healthcare organization, so where's all of the food coming from?
It's all the goodwill that American Diversity Group have come up in the system, that people have faith in us. People have given us some grant. I got it something. I got the donations from the county also. The food that Montgomery County is helping us.
Okay.
There's also a group called Health Initiative Foundation who have helped me to come up with some help with the funding. There are other people out in the community who are coming out, and the grocery stores are coming out and giving away the donation of food.
Okay.
So it's a lot of collaborative efforts out in the community. People are coming out and giving away the donation of the food, as well as some in-kind donations, some cash donations. It's coming up. So it's just that the American Diversity Group have developed that goodwill up in the system, that people have that faith in us, that we can be able to do some justice out to the community.
Okay, so really your history in the community has really made it such that people are coming to you to use you to help the community. That's good.
Exactly.
So
yeah, go ahead.
I was going to ask, how can our viewers support the work that you're doing? Yeah.
Afriquetoday, I would like to reach out to the people out who are listening, and also to the people out in the community, that I have this food for you guys. Please do not hesitate to come to me on Saturday. That's on Asta Medical Adult Daycare. If you have a paper and a pen, please write it down. Asta Adult Daycare. It's on 12210 Plum Orchard Drive, Suite 214. Again, I repeat, is 12210 Plum Orchard Drive, Suite 214, Silver Spring, Maryland 20904. Again, Silver Spring, Maryland 20904. The timings are from 10 o'clock till 12 o'clock. But trust me, if you are there, you are coming late, even after 12 o'clock, I will not say no to you. I'll be there for you. I will be giving away tons of food to you guys that will last at least for 10 to 15 days in your family. So please come and spread the word. Afriquetoday, help me to reach out to your listeners, to the people out here in our community, to please come to 12210 Plum Orchard Drive, Suite 214, to get the food. And tell your friends and families to please come. No matter what, we are not going to ask you any questions, nothing. If you have there in your car, kindly open the trunk. The volunteers will simply drop the food and allow you to go. No question asked, and nothing will be happening. We'll just make sure that you are safe, and we'll get you out in 30 seconds.
Okay, great. So do you also need volunteers? I know there are people who might want to come help you or donate something. How can they reach out to donate, or if people want to volunteer with American Diversity Group?
That's a good question. If people would like to come and help me to volunteer, I have also as we maintain the social distancing. If they would like to come, at least just see if there's not enough volunteers. You can check it from the other side and see if you can just come in, wear your mask, and just get into the system and start giving out the foods to the people, if you are there. Because I have a team of about 10 to 15 volunteers. But I don't want it to, increase the volunteers also, so that way we get crowded also, So I wanted to make sure that we maintain that social distancing and help out also our volunteers not to get into the system. So definitely, you are welcome, but as I said, that please use your judgment and see if the things are getting slowed down, and you could be of some help, and there's some kind of a social distancing that could be maintained. We will be able to get your help just without even asking me. Just get into the table and start giving out the food. So I'll be there in and out helping out. But if you think that you could help, use your judgment and try to make sure that the communities are going out, the flow is going on. We'll be having almost 700 to 800 cars. So definitely we want to make sure that the traffic is also not jammed up.
Yeah, yeah. Okay, good. And I'm guessing also you're accepting financial donations and people can contact you, the organization. How can they reach the organization?
So, like at that same, they can give the donation by check or through my website. They can come and donate it through my website.
Okay.
Or they can send it to my office address. That's at my website, American Diversity Group. They can send the checks to American Diversity Group as well. So any donations that's been given out at this time, it's absolutely going back to the community. There's no add-on cost or anything, any amount that comes. We buy the food for you guys and that money goes back. So we are not using any kind of donations that come during this time to any other areas. We make sure that the money that comes to this cause is going exactly to the food donation cause.
Okay. Wow, thank you so much, Mayor. You and your volunteers are really an inspiration for us in this difficult time. So we're really thankful for all that you're doing to help our community. What message do you have for our viewers before you go?
Yeah, just I wanted to ask my viewers and to other guys that make sure that if you have any issues or conditions, American Diversity Group is there for you. And we are also going to start the dental issues, because I remember that a lot of people have gone out of insurance because of their job loss. So they will not only telemedicine is there for you, but we will be also planning to do dental part, whereby we can see you via teledentistry. If we are not able to see them, then we can go and have the doctor see you, try to help you do the cleaning and treatment at either no cost or low cost.
Wow. Thank you so much. These are really resources that our community needs. So thank you. So you all have heard, go out on Saturday to get some food from the American Diversity Group, or, if you need healthcare needs, or they're doing telemedicine now and teledentistry soon. So please seek them out if you need the services. Thank you so much, Mayor, for all you're doing to help our community out. Yeah.
Thank you.
Now we're going to go to the next segment, which is talking to two people on the front lines, healthcare workers during this pandemic. The first person is Dr. Konate, who is an epidemiologist who currently works with works as a disease control program manager for the Prince George's County Health Department, and she's actively involved in the COVID-19 response. She is originally from Guinea and obtained her medical degree in medicine and general surgery from the University of Bologna in Italy, and her master's in public health from Texas A&M University. So Dr. Konate has a lengthy background in medical support services and public health program development, especially for immigrants and refugees. She's the vice president and health coordinator for the Seal of Hope, that is a nonprofit organization that is based in Maryland and is actively involved in helping new immigrants integrate into their communities. She has worked for the International Organization for Migrations, addressing the healthcare needs of over 200,000 refugees spread over 6 camps. She was a public health advisor for the Center for Disease Control and was instrumental in the community outreach during Ebola at the New York Department of Mental Health and Hygiene in 2014. So thank you so much, Dr. Konate, for all you're doing.
Thank you. Thank you so much.
Yeah. And our next healthcare professional is Nurse Aurelie. She has been a nurse for over 14 years, caring for diverse populations, engaged in education, screening, and other health prevention and promotion activities in the Washington, D.C. metro area. She has been a triage nurse for mobile medical clinic, a nurse advisor for the National Kidney Foundation, and she's the community outreach director for the Cameroonian Nurses Association in the USA. And she's currently caring for our nation's military and veterans. So thank you so much, Nurse Aurelie, for all you're doing.
My pleasure. Thank you for having me.
Yeah. So welcome again to this segment of discussions. And today we're really going to talk about your experiences. So maybe let's start with Nurse Aurelie. Can you tell our viewers a little bit about what you're doing with the Cameroonian Nurses Association?
The Cameroonian Nurses Association is an organization that was created in 2005 by several Cameroonian nurses that actually graduated in the US, and most of them were from the community college. We came together because we knew that our community, we had a lot of people that were immigrants, sometimes with no knowledge, no information about healthcare, what their rights were and what their needs also were. So we were able to put in place a system by doing community outreach. We go to the community, and we had in the beginning a basic program called Know Your Numbers. Know Your Numbers were a program that we put in place because we realized that in the community, we were having a high number of people dying from stroke. And stroke is actually something that you can prevent. So we put in place a simple program called Know Your Numbers by just going to the community and showing to them what the basic blood pressure number were and how to screen. We were doing the first blood pressure reading, and we were also sending them to places like CVS, Giant. They have a free blood pressure machine there. And with the first reading, we will give them a card. And in that card, you will have a baseline blood pressure level. And then if on their own, they can do 2 or 3 other pressure, for instance, and they realize that the numbers are high, they can come back to us and we can refer them back to community providers. And in our group also, about 90% of our members are right now master's level educated nurses. And we have several of our members that own their own medical clinics. We have also a nurse that became a medical doctor. So we can provide an extended service. And those people that did not have an insurance or a physician in place, they can come back to our clinic and see our doctors. And when they have a prescription, they can go back now to Walmart and buy a blood pressure medication for $4 for 1 month and $9 for 3 months. By just doing a simple stuff like that, you can prevent a stroke, because someone can have the blood pressure on the check being managed properly, and then avoiding going to the ER and staying in. We know that a patient with a stroke will spend at least a month in intensive care. Now with the COVID, we are also out there educating patients, because we have a different community and we have different habits. We like to live together, socializing, spending time with families and friends. But at this moment, we cannot do it because it's a disease that is contagious. And the contagion is, you can have a disease and not having the signs and symptoms at that moment, but you can still contaminate someone else. So we have to educate people now to understand the importance of following the protocol in place.
Okay. Well, thank you. That's a lot of education and health promotion that you're doing for our community.
Yes.
Yeah. And I just got a notice from the viewers. Aurelie, do you mind bringing down your camera just a little? We cannot see your whole face, unfortunately. Perfect. Yes, that's beautiful. Yeah.
Sorry about that.
Oh, no, that's fine. This technology, we are all learning to work in this new normal that everything's virtual.
Thank you.
Yeah, thank you. So, Dr. Konate, I know not a day goes by without me hearing about the term epidemiologist, what the epidemiologists have said. So can you tell us a little bit more about what you do as an epidemiologist, and how is your work going during this time of COVID-19 pandemic?
Oh, okay. Good evening again to you and our viewers. Again, my name is Sona Konate. I am an epidemiologist with the Prince George's County Health Department, and I'm also the program manager for the communicable and vector-borne disease control. I always manage the rabies program, but right now is about COVID-19. Usually, my department manages more than 66 diseases and plus the
it's a lot.
Yes. Including Ebola, Zika, just name it. The only thing we don't do in my department is HIV/AIDS and TB and STDs. Everything else is us. But let me tell you, for the past 2-3 months, we have seen almost 99% of our disease was COVID-19. And the only program that is still sending right now is the rabies program, because rabies is fatal. So we need to make sure, we manage our bites. And so people won't get, because rabies can kill you, it's fatal. So when a bite, you need to be taken care of immediately. That's the only program right now that is also still standing. Everything, I'm not saying that they're neglected, but COVID-19 has taken over our daily activities. So what we do as epidemiologists, we do receive all the results for COVID-19 for the county. All results, negative or positives. So our role is to make sure we reach out to the patients, let them know sometime about the diagnosis, some don't know, and we need to follow them. We need to make sure we manage them, we make sure they're okay, we need to manage their symptoms, we need to do the contact tracing, we need to follow them until the symptoms are resolved and until they're ready to go back to work with the normal, and we release them the return to work letter or the clearance letter, whatever it is. And so let me tell you, we have the most humbling and important job, because sometimes we come across some patients, they are sick, they are scared to go to the hospital, or they don't have insurance, they don't speak the language, and we are the only link between them and the safety and healthcare. I call myself personally 911 for so many patients, because without that, they would have been in trouble or even passed away because they were short of breath, but they did not dare go into the hospital. They did not dare even because of the stigma associated, telling nobody. So this moment has been very humbling. I think an amazing moment for us to rethink the way we work, to rethink the way we communicate with others, and the way also we involve everybody in their own healthcare. I was listening to Mr. Dr. Mayer before, the healthcare organization. That is amazing, because me, as an epidemiologist, I not only manage my patients, I also try to research resources every single day, because when they tell me about housing, they tell me about jobs, they tell me about food they don't have, they tell me about money. So I'm trying to do a contact tracing to tell someone to stay home, to self-isolate or in quarantine, and they tell me I don't have food. They tell me I'd rather go outside die because I need to go out. So what do I do for them? So we all turn into social workers as well. We turn all into multitaskers as well, because that's what we do. So me and my coworkers, we have put together, we still put together every single day resources, where to find food, where to apply for, delivery services, where to apply for transportation, where to free healthcare, where to be tested. Luckily, in my department, we do testing. And now as we go, it's getting much, much easier. So we don't necessarily have to follow, the CDC criteria, that were a little bit strict, or you don't have to have a prescription for your medical provider to be tested. So hopefully now things are much better and we can help people better, because my biggest challenge before was a patient to tell them, I don't know, I'm sorry, I can't help you. And I take a pride in having some resources to give my patient, because I might be the only link between that person and safety. If I let him go, I hang up on them, I tell them, oh, you know what, I'm not the right person, call the other office. They might never call again. They might be so intimidated, and they just stay there and be in trouble. So that's what we do. We are in the front line, happy to every day we go on the ground, we risk our lives, but that's what I sign up for. I am an MD and I sign up for that. So no complaint, but a lot of humility, a lot of pride, and every morning I get up to go to work. I feel that it's a privilege for me. As you were telling before, I work with the refugees after medical school. My first thing, I went back home in Guinea, my hometown, and I started working as a medical officer for the migration, and I was dealing with refugees, the underserved population, and that's my kind of population I like to serve. I love serving people who don't have access to nothing, don't even know what a stethoscope is, don't even know, what a little comfort is. So that's where I am the most proud of. I also went in other countries to help, in Kenya with the refugee population. So I have seen so many things in life. I have seen so many pathologies, and that makes me so rich and so humble and I'll do it again and again and again. So thank you for having me today. And it's a big pride, that I'm ready, to assist, to help. Whoever needs my service, advices, I will do it. Last but not least, Seal of Hope is also an NGO. I am the vice president and health director. We do have 4 principal programs for areas we work in. The first is to help the new immigrants that come in the country, to help them with the legal services, other services. And I'm proud to say that we have lawyer friends. Ms. Fatmata Bari is one of them, who have helped us do clinics, free clinics, to help immigrants navigate through the system and have them there apply for benefits, and try to apply, especially during the the Ebola. They offered what you call the TPS, temporary status, where immigrants have the possibility to become legal, even if it was temporary. Our community was so scared because they say, oh, it's a trick to get us and them to come and catch us. But I told them, if you don't do that, if you don't take the first step, you're going to stay in the dark forever. Some people have been here for 25 years, for 30 years. They are still living like mice. But I tell them, guess what? You have a cell phone, you have a bank card. The government know where you are. You just have, to make sure you are legal, at least you have a chance. So in case a better opportunity come, you're already in the system. So we were able, to convince many of them to come out. Hopefully, when things get better, there are other opportunities. They already have at least a social security number, even if it's not working. At least, they have a chance to come out. The second thing we work on, humanitarian aspect. During Ebola, we went to Sierra Leone, Liberia, Guinea. We gave containers of gloves and gloves to people to help them with those PPEs to help the frontline workers. And here right now with the COVID-19 also, we have been distributing gloves and masks and also education in the community. Actually, I host a radio program also that is Seal of Hope, Going Home, is a program we do to educate our communities. I'm also part of an association called Guinean Health Professional Association. We do programs also frequently to educate our populations in different languages, local languages, because sometimes they don't speak English or French. So we need to make sure they understand the message. Because as my colleague Aurélie was saying before, it's all about getting them the message, education, so they can follow the basic control measures. And the third aspect, what we do in Africa, we help agricultures with the crops to try to put some technology so they can improve the crops and improve also the methodology, so they can have more income for their families, to work smarter but less harder, right? So the last thing we do also, we try with my president, George Koshu, the president of Seal of Hope, try to work on technology, try to teach the youth how to work with computers, not how to use them, but how to repair them. So that can be a job for them. And that's also something we do. And I'm so sorry, I'm extending, but that program, our gold standard program, is the water, clean water. We also have a program with clean water. We are partnering with a company to provide clean water to remote areas. That is, we have a machine that will provide, we transform water from sea, dirty water, nuclear water, in water. So that's also what we do. So I'm sorry for being so long. There is so much to say, but I just wanted to tell you, what we are, what we do, and we are here to help, to support, and to assist our community. So thank you so much for the platform.
Wow, Dr. Konate, thank you so much. I see, we can definitely see your heart of service, and I think maybe Immigrant Community Services might have to work on having you come back later to talk about kind of the other work you're doing while we're talking about you today in your role as an epidemiologist and working on the COVID-19 pandemic. I think there's room for learning more about what your organization is doing and how you can help our community. So we'll definitely plan on having you come back again.
Anytime. Thank you, Doctor.
Yeah. But to our viewers, as you all know, with our segments, we're going to have questions and answers at the end of the panel presentation with our guests. So please send in your questions to either our Facebook group or the WhatsApp number, and we'll be ready to answer them when we get to the question and answer session. So my next question for you too is, can you help non-allied workers or people who are not in the front line right now understand how your job has changed or your work has changed in the context of the COVID-19 pandemic? Are there things you're doing differently, and How has that really changed?
Is that a question for me?
You both, yes.
Miss Aurelie, you want to start, or?
You can start. I can right after you.
Okay, thank you so much. Okay, so the world has changed a lot. As I say right now, we are having so many diseases, GI issues, outbreaks, so many things. But because of COVID-19, it's like everything else has stopped. And so it was all about COVID-19 for the month of March, for the month of April. I have had days where I was working 23 hours or over 24.
Wow.
Seriously. As a county official, we take care not only of patients, we also oversee all the schools in our district, the communities, the hospitals, the physician practices. So we oversee all the healthcare facilities. We provide guidelines and we enforce guidelines. So we had to deal with a lot. A doctor will call you what to do. We need to test this patient. At the beginning, nobody knew. The funeral homes, we call what to do. People need PPE at the beginning, nobody could find gloves anymore. Nobody could find a PPE anymore. At the beginning, it was a bit wild. People didn't know what to do. And so we had to stand up. We had to be, to definitely, stand strong and assist all those people. Besides, keep doing our daily job. What our daily job is. As Dr. Meyer was saying, we do have other diseases. People are still have other sicknesses that are also deadly. So after all the turmoil, we had to divide ourselves in the office. Okay, some people will still focus today on other diseases because people get sick of other diseases. It's not only some people will still, taking care of COVID-19 on a daily basis, and some people will take care of outbreaks. We also oversee childcare. We also oversee nursing homes. We oversee group homes. We oversee all those structures. So we have, as a government, local government, we have a big responsibility, and we had to be strong to people. People call us, they don't know. We didn't know all the time, but we have to find answers for them. So we have the state who help us out. We also have the CDC, who is also above the state. So we have to find resources. We have to research. We have to be on top of our games. Hopefully, Maryland, we are very thankful. We were, have, great resources. People came together, the authorities, and we definitely had, strong guidelines we can follow and we can share with people. I want to, commend all our coworkers, all the officials who took upon themselves to work extra hours. My staff, I will call someone at 2 a.m. in the morning, at 3 a.m. in the morning. We will work like 24/7. The month of March was a very interesting month. But guess what? We are so humble. We are so happy. When people call us, they are grateful. And I told them, we're going to hug later, okay? Let's keep the hug and the coffee for later. But for now, we need all boots on the ground. And we did it. And now we are in a much better place. We are learning a lot. We are trying, to do heart washes to see how we can do better. But the lesson learned here is preparedness. We need to be ready. This pandemic have shown so much fault pits in our system. So this should be not only a challenge, but an opportunity to be better prepared next time anything like that happened to us. We're still fighting it. And I don't want to finish this before paying respect to all the people we have lost to this disease, to all the people who are sick. I have lost coworkers. I have so many of my coworkers who are sick. Hopefully many recovered. Some people maybe will still get sick, and I pray for them every single day. I tell them, be strong, keep relationship with your primary care physician, because we don't have a cure yet, but we need to treat symptoms, okay? Don't think it's a regular sneeze. Don't think it's a regular allergy. It might be more serious than that. You might be asymptomatic, but still shedding the virus, and you might put people around you at risk. Maybe they are a little bit more vulnerable than you are. So love yourself, love the others, and please, when you wear the mask on and you wash your hands, you keep away distancing, you show care. you show respect for your neighbors, for your family, and for your friend, okay? So we are together in this. Together we stand and we will win. Thank you.
Yeah, thanks. Yeah, Ms. O'Reilly, what about you?
I will say that as the number of confirmed COVID patients accelerated in the US, we nurses, we are finding ourselves in an unprecedented situation. We are tested in a way that we have never been tested in the past. We are dealing with a truly uncharted territory, and which means you can see the magnitude of the pandemic. It's something that we've never seen. The population, today we are more than 100,000 deaths in the US. That's a lot of people dying. That's a lot of family grieving. So it's a time of great stress and uncertainty and nursing. But, you know, I would say that nurses, we are rising, you know, to the challenges, because really it's a lot of challenges. And we are the backbone of America healthcare, and often it's heart and soul. The pandemic is testing all of us. But nurses, we are in the front line. It's like a soldier going to war. You have to do what you have to do. And our role actually now is more important than ever. We are often the last thread of compassion for others. And you can see with COVID-19, when somebody is sick, the family cannot come in the room and visit that person. At the time, you will have the nurse being the last person to see the patient dying and to give the news to the family what happened. How did that happen? In the past, you used to have the family gathering around the patient, praying with the patient, holding hands. But if a patient is admitted to the hospital right now with a diagnosis of COVID-19, no visitors. So it's loneliness, it's fear, it's anxiety. You know, our first priority as professionals is that we are caregivers. We are there to care for patients. When you sign up to being a nurse, your primary role is to do your best for the patient to get the best outcome. But in this situation, you don't have that option sometimes. There have been times where nurses are tested. You have to find out who are you giving this vent to and who are you not giving that to. Some patient, maybe a patient with a diagnosis of cancer, cannot come to the hospital because we have to empty the hospital bed for the patient that are coming in. We don't know how many were coming in, but we've seen the trend is very high and we cannot control it, because if people are not following the protocol and listening to the CDC recommendation and doing what is expected to them to do, we will have an increased level of infection in the community and in our society. To protect the nurse, protect yourself. Wear your mask, stay away if you can't, go only out if you need to go out. It's a simple recommendation. We've seen what happened in New York. We have seen that you have less death in New York because people are following the protocol. And this is what is called education, educating the community. But the community also have to accept and practice what they receive from the nurses. The stake is very high, and unfortunately, there are no good answers. Right now, I can say that part of our job is that we have to come together and we have to care for each other, but nurses also have to care for themselves, because you see nurses that you go to work in the morning, by the time you come home, you have bagged 3 to 4 patients that are dead in one shift. That takes a toll on the nurse. And it's a lot. And the next day, so on and so on. You have nurses that have changed role. Some nurses that were working maybe in the primary care unit, now they have to be trained to work in intensive care unit. And it's putting more pressure. Now, when you go home, are you going home to help your children? No. Because if you come home after taking care of COVID patients, yes, you can shower and do all that. But some nurses I've seen a nurse that have set up a tent outside her house because she didn't want to contaminate the entire family. Her mother and her father were in the house. So what do you do with all that? So it's a different situation that we're dealing with now.
Yeah. So you guys are basically saying that nurses have just roll up their sleeves. Well, not only nurses, healthcare professionals and frontline workers have rolled up their sleeves, and you guys you're telling us you're doing it and you love doing the job, and it can be challenging. So the question that I have as a follow-up is, what is it that you're doing as self-care for yourself? How are you all caring for yourselves?
The burnout, is it my question or somebody else?
You can start, and then we'll go to Dr. Konate.
Even before the crisis, burnout among clinicians was very high already. We had a very stressed healthcare system in the US. We have a need for nurses that were not met at all. Now with the COVID-19, you see, you have more pressure because the patients are sicker. And if you have COVID-19 in addition to other diseases, diabetes, hypertension, that created more problem, because you will have a patient that would not just take a pill, but might be attached to a ventilator in the hospital. If a patient is attached to the ventilator in the hospital, that patient will need a respiratory therapist, one-to-one nurse. That patient will need ICU bed. That patient is a high acute patient. So that more pressure for the nurses. And the operation of the hospital have changed in many ways. You've seen a hospital where you have a nurse working, instead of working 3/12, you have nursing working 5/12 shifts back to back because of the need. If you cannot put a non-experienced nurse to take care of a patient in the vent, you kill that patient. And we have also have a lot of training, but you cannot, training now are virtual. Some trainings need to be hands-on. So the virtual trainings will not give that nurse the skills that she needs to have to be an appropriate healthcare agent for the patient in the bed. So the skilled nurse, the experienced nurse are doing a lot more. And at times, you also have, when you have a patient, knowing that you cannot do anything for that patient, and then you see the patient dying, it's really traumatizing at times, because we get attached to our patient. Our patient, they become like family members to us. So at some point, when you lose a patient, it's like you have lost the battle. And it's hard. We grieve. But we also have to remember that we are there, we are giving them the best. Every day when I go to work, my men, and even that's what the Cameroonian American Association men, I can say that our main objective, providing an exceptional services to all our patients on a daily basis, regardless of the situation. Do your best at all times. So it's important for us to remember that we are there to provide the care by being professional, but also having compassion.
Mm-hmm.
You have to be compassionate. You're seeing a patient coming in the hospital with nobody around it. You need a high level of compassion. And you cannot send people in the room of that patient like you used to be, because to go inside the room of a COVID-19 patient, you need to be dressed up. You have to wear a gown, a mask, an I-95, and hood, a shield. It's a lot of things that you have to put in. You cannot go in like that. Mm-hmm. And I would take the case of a patient that in the past, if a patient was having a cardiac arrest, you would call rapid response or code blue. A code blue is usually a team of maybe 8 professionals that would come in the patient room. Someone will be doing CPR, a doctor will be giving order of medication, somebody will writing down what is happening, the medication and what time, and so on. And so it's a whole team. But right now, because of COVID-19, you can only have a certain limited of healthcare professional in the room to minimize exposure.
Yeah.
And
yeah, so it really seems like while the job is changing, nurses you're also adapting. And I think one of the best ways you say you're trying to really care for yourself is doing the necessary precautions that you have to take and taking the time to grieve when something bad happens. Yeah.
And I think that we are doing it, and we are taking care of each other. That's one of the most important things right now. Okay. We are coming together and encouraging each other and grieving together. We're working as a team. That's the only way we can make it.
Good, good. So Dr. Konate, how are you practicing self-care?
That's a good question. I'm also responsible for a team, a big team. We have had to recruit so many other workers from other programs, like the food protection program, from the WIC program, from the M-SHIP program, kids insurance program, because we needed help. I have that responsibility of caring of all those people. So what motivates me is the fact that all those people who didn't know the epidemiology job yet have all came, trained, and helping us out. And they learn so fast, so quickly. They become so passionate. So those are one of my biggest motivation. All of them came, now most of people were put on administrative leave and they are home. Some people are not working because they can't work. They have to be on the ground. So they are home. So all those people came from their home leave and came to help us, and they are loving it. So those are my main motivation. I say, wow, those people came, they trained, they are helping me every day. They come and ask me a question and they are loving it. The relationship with the patient, they know they are making a difference. So I think that is one of my main motivation that keeps going. And also the fact that I know that I am making a difference every single day. I know that if I don't give a call to that patient, maybe nobody else will. I know that if I don't call them to educate them on what to do, to not go to work because they are asymptomatic, but I know they can infect someone, to stop them to spread. And I think I make a difference, and that makes me happy. One at a time. I remember again when I had my first patient, my second, my third patient, I was calling those people maybe 3 times a day. How are you doing? How are you doing? Now I can barely call a patient within the 10 days because how much cases we have. Like we, past the maybe 15,000 right now. It's challenging. It's just coming. But knowing that, you can help people, you have an important job. This is now our time to step up for our communities. That's humbled me down, and that keeps me going. And I want to thank also our nurses. We have also nurses in our department. They are, amazing. As we receive all the specimen from everywhere. We have to give, support to other facilities, structures. We give support to everybody else at the county health department. So we have to be the big girls and big boys. We have to put our big girls and big boys pants on to help other people. That gives me motivation. Personally, sometimes, what I do for personal self-care is some reading. I do some reading. I try to see what's happening around the world. Sometimes, I look at, some little, videos, of music that I like, that makes me happy. I pray a lot, and all that, help me keeping, my mental myself. And, I talk to my children, and as a matter of fact, I have a senior graduating this year. And so we've put, a kind of, sign in the front yard so everybody can, know that, we have a senior virtual, so we can't do nothing. But, so neighbor will come, hi, hello, all that makes my day. All that keeps me, grounded, keeps me motivated. So, and staying alive. I am alive. I am still okay right now. And all that makes me grateful. Every day I come back home, I go to my garage, I Clorox myself up, I remove my outfit, I remove my gloves, my mask. I stay a little bit there, before I come to the house because I want to protect my family, right? And so the fact that every day I can still get up again, go back to work, even when I sneeze, I have my allergies. I think I diagnosed myself with COVID. I said, oh my goodness, maybe I caught it. And then the next morning, I'm fine. I say, okay, I'm fine today again. Let's go do it again. So every day is a repeat cycle, but every day I am humbled. Every day I am grateful. And every day that keeps me motivated. And I am able to also to transmit the same gratitude to people. So I ask my staff every day, are you guys okay? You fine? Even my boss, I ask my boss, are you okay? People think that bosses are, not only, they are humans. Maybe they are scared, more scared than you are, but they will, be the big one because they think that they don't know. So you ask everyone, Are you okay? Okay. Thank you for your service. Thank everybody every day for your service. So Miss Aurélie, thank you so much for your service. It was nurses. We did so many things for nurses because they deserve it, And so thank you so much. You guys, I remember I am a mother. So whenever I was giving birth, the only face I remember is the nurse. I asked them for forgiveness after. They asked me, I cursed a nurse so bad that I had to ask them, so sorry. So, but you guys, could pull up with it. You guys, just are still nice, are still, taking care of the patient. So I am so grateful to nurses. So thank you. You rock and you are amazing. God bless you.
Thank you. God bless you too. It's a team effort. We all are in it together.
Yes, thank you.
I guess I would say thank you to all you who are on the front line. And it really seems like we can tell how passionate you are about the work that you're doing. So we really appreciate you for being passionate and putting in the effort. You've talked about how you prepare. You've talked about how you take care of yourselves to care for your patients and even to care for your families. And you've also talked a little bit about how your work life has changed. So what I'm curious about, or what maybe we can tell our viewers a little bit, is how has your personal lives changed because of COVID?
The stakes are very high, and unfortunately, there are not really good answers to that, in the sense that we have a new game right now. But the bottom line here is that nurses have the same obligation to self as to others. Investment is oneself. It's not an option. It's a mandate. A self-care deficit is something that we have seen a lot in nurses. But right now, we are encouraging nurses to take care of themselves also, as well as taking care of the patient. A nurse that is tired, a nurse that is sick will not be effective on her job. So we want a nurse that, for me personally, what I do is that I exercise every day. I eat well, I take vitamins, but I also practice gratitude. When the day ends, I look forward to what was good and what I've done. And to me, that brings me a lot of joy. There will be something that you will find in your day that will be positive if you look around seriously. I'm grateful that not all my patients will die in one day. Some of them will recover. They will be going home. I'm coming home. We have cases where nurses have lost their lives. I still have family around me and friends. I can contribute. And that makes a difference. So we all can see things with a different outlook. Mostly is how you see things. Do your best. It is not the perfect world. Things have changed. Some people have lost multiple family members in addition to losing the job. What do you do in such situation? And sometimes some people have had businesses for years and there will be no recovery, So it's a new day, but we cannot lose the battle right now. We cannot say it's over. We have lost it. No, we're in the process and we are learning. And as we learn, we will find new ways. And I'm sure just as we have had adversity in the past, we will strive and something even better will come out of it. But we all have to learn and make the best of what we have learned, just in case if we had something like this coming again. Because the recommendation sometimes comes, but the practice, people are not practicing what they're hearing. So the expert, the policymaker, they have seen what was going to happen. There's 100,000 deaths in America was something that was predicted. So we've seen that, and then we knew that that was coming. We, the population, are the one we need to protect ourselves. Nobody will come to your house and put the mask in your face if you go out. You have to do that on your own. If you don't have a mask, you can go on YouTube. There are ways to learn how to. You can use a scarf. There's so many different ways of protecting yourself. Or stay home.
Yeah, definitely. There's things that we can do. But Dr. Konate, any things about your personal life that have changed?
Absolutely. First of all, I don't have to wear lipstick anymore because nobody will see it. So that's a good thing. mask all the time. If you don't have a mask, you don't get into my building. We have universal masking. We take temperatures. And now is not even about anymore, yourself. It's about others. Of course, I need to stay well, to stay alive, in order to be helping others. But, you have to think now team. You have to think community. You have to think as a whole. How best can I go tomorrow and be at my best? How best can I go tomorrow, and be able to improve? How best can I go tomorrow and be able to address one of the questions someone asked me yesterday I didn't know about, is all collaboration. Ask your coworker, maybe someone can come across. We are epidemiologists, so we call people every day. That's what we do. We are in contact with the community, with the population. So you might have a direct contact with someone who will teach you something, asking you a question that will lead you to do some research, that will lead you to have some resources. Like someone last week asked me about food. They told me, I don't have food. You are asking me to stay home, I don't have food. I say, oh my God, what do I do? I say, okay. So I went to ask another department, how can I tell my patient will ask me for food? That lady was so nice. She sent me a list of resources where people can have free food, even some businesses where they can have free pizzas and free food. I didn't know. So I called my coworker. I said, you know what, let's start a resource-based database. So we put it together. So now people call us and we share it with other colleagues. People call us, we proudly can tell them what to do, where to go. And that is so, so humbling. And so just to tell you, now we are in a spirit of giving or sharing. Some of us still have a job, and that is very, very humbling to me, because some people I know before, they were big managers, they were big, big bosses, business owners. I already was saying they lost it all. They lost the job, hospitality, food. They did. And seeing those people there in a community now, you know that now they're laying on unemployment. Some didn't even get an employment yet because the list was so long. So seeing those people around, you know their situation. So sometimes, you know them, giving them a call. How are you doing today? And without even having them needing to open their mouth. I think they are so happy that someone cares about them. Some people are immunocompromised. They are there, home. They can't go anywhere. They just rely on goodwill. Like people like, maybe Dr. Mayers, who offer, some services, some food. That is so humbling. So I am grateful because I still have a work. I know sometimes it's dangerous, what we do every day. They might tell us tomorrow, oh, the person you were talking to is infected. You self-quarantine. And I would be heartbroken because I need work. I want to stay working because I know people still need services. So we have to be more careful. I have to protect myself for others, not only for me, for my family, also for others, because I want to stay working. I have to be a better person every single day. I'm not working out very well. My gym membership, I've had it for 3 years. Maybe I've gone maybe once a year. That's a shame. But I try. I am very active. So I can work miles in my house and in my office. So that's my workout there. That orally, that's my workout. Okay, I'm not like you, but I try. So that was, everybody, try to do the best. That's me. And, I try, also, to be positive, to smile, to talk to people, to share what I have, knowledge, jokes. And that's the way we keep going. And humility, gratitude every single day. And that's the way he has changed me. I'm already a humanitarian person. Straight out of med school, I went straight to work in public hospitals in Guinea to learn the tropical diseases. After that, I went to work for the UN, and not every UN, for the refugee program, because that's where I am. That's where I find myself. I'm a public health person. I did clinic because I used to do the screening, medical screening also to refugees, many of them, but also public health because I had to take care of their mental health. I had to take care of the physical health. And that was so humbling to me. So I love my fellow human beings, and I am happy to serve anytime.
Wow. Thank you so much. Thank you both. We can see the passion that you have for your jobs and the passion that you have for service. So we really appreciate you taking the time to come and share your experiences. So let's now turn to what are the questions that our viewers have for you. So there are quite a few coming. So let me look and see really quickly. So a viewer has a question about, let's see. My partner and I both work in the front lines. How do you advise that we protect ourselves and our families right now?
Really, you want to take a shot at that, or you want me to respond?
You can start it. I could just go after you.
Okay, so part of my job also is I oversee also the health of our fire deputies and also our police officers. So we run into people who work in the front line every single day. So what's the best advice we give them? You are an essential worker. Before, whenever someone was exposed, our deputies, they transport people. If it's police, they do arrests. So they come in contact, with population. Sometimes they are not wearing masks, sometimes. So we need to make sure they're okay. So we tell them, you have to make sure, first of all, any call you receive, any call from 911, any dispatch you receive, you need to make sure you treat it as a COVID-19 potential patient. So you have to protect yourself. And I don't want to deviate from your viewer's question. They are both frontline workers. I don't know what kind of exposure they have, but since we don't have a cure, the only thing we need to do what we can control. We can control our behavior. We can control the respect of the basic measures. So wear your mask, put your mask on. Depending on what kind of job you do, you might have an N95 or a regular surgical mask if you don't have much exposure. Try to have gloves on if you touch so many high-touch surfaces, or if you can't put gloves on, wash your hands frequently. Now, part of your daily routine has to be hand washing breaks. Once in a while, take a break, wash your hands. As you know, sometimes if coronavirus get into your hands, by touching, your face, when they say face, not much, maybe your skin, that is a little bit stronger, your mucosis, like the inside your mouth, your nose, or your eyes, that can absorb the virus, and you can catch the virus that way. So make sure, if you can wear gloves, just wash your hands frequently. Whenever you touch a surface, make sure you wash your hands again. If you don't have access to water and soap, just, have a hand sanitizer, and then you can wash off the virus. And you and your partner, use social distancing. I know some people laugh at my face when I tell them in the house, please, keep the distancing even with your spouse and, your children. That women laugh at my face. I say, I'm not kidding. Is that, some of you guys might carry the virus, but is just an innocent carrier, means that they are not sick, not symptomatic, but they can still shed the virus, while your partner is more vulnerable or catch the virus and get sick. So that's why even if you're in the same household, sometimes use some precaution, and use that distancing, at least, to protect yourself. Hopefully this virus will understand exactly this behavior. We know it's vicious. We don't know exactly how it acts. So we think it's droplets, but the way it's so vicious, I won't be surprised to know that there is another mode of transmission. We don't know. So what you can control, your own behavior, social distancing, put your mask on, wash your hands frequently, and when you come home, you have your family, try to have a station, a place, transition place in a garage or in a small room where you remove all your clothes and your shoes and just come out clean. Go take a shower, put new clothes on, and then you can mingle with the rest of the family. Even though, just be very careful in order to protect the more vulnerable. Let's not take any chances.
Thank you. Ms. Aurelie, anything to add?
I will add to what she said it all. So basically, is wearing your mask. If you are, I probably will talk more about our community. We've seen a lot of issue with nursing homes, and one of the area where most African will be working are in the nursing homes. We've seen that the nursing home in the past didn't have even the policy in place to protect the worker. And if a worker, someone working in that workplace, go to work without PPE, without N95, taking care of a patient that have COVID-19, going from room to room, that nurse is also at risk and putting other patients at risk. That's why we're seeing a high level of COVID-19 death in nursing homes patients. Those patients have compromised immune system because they do have other diseases. There's comorbidity involved. So you have a patient that is aging, diabetic, hypertensive, and maybe sometimes cancer. So you have a combination of issue that can put someone with that, someone with an issue like that prior to having a diagnostic of COVID-19, that patient would be sicker because the immune system will not be able to fight the disease. In some of us, if the disease get a normal patient, most of the time you will see that the patient will not be in ICU, intubated and everything. They will, they will recover from the disease. So at this point, if you have a nurse going to those places, she need to have an N95 mask on. The nursing, I will talk specifically about the nursing home because that's where the target is right now, because our African populations works more in there. They have to have a way of putting all the patients with the diagnostic of COVID-19 on one side of the unit, separating the patient with disease from the patient with no non-disease, doing a test, usually a weekly, if it's not even a daily test on those COVID-19 patients and see the progression of the disease on those patients. If it's not negative, in my hospital, you have to have 2 sets of negative results to be discharged to any place. Before the patient comes in, they have to be tested. Every day, even me when I'm going to work, they check my temperature. I have to have a mask on before I enter my hospital. That's the requirement. No visitors. So things like that. And we also have a place where additional protective equipment will cost money for the facility, but the facility have to do that to prevent a loss of life. We have to see the lives of people as more important than the financial, benefit of it. Because right now, if a nurse gets the disease, that nurse can take the disease home, and her children, husband, and maybe parents would be, at risk of getting that disease as well. So it's a team effort. It's an effort. I have to do the best for myself, but also the community, the facility where we're working, it's a team effort.
Yeah, wow, definitely. So the quick response is make sure you're following all the guidelines and even encourage the facility where you're working to try to get you the resources that you need. Okay.
And I will add one thing, that the Cameroonian Nurses Association, we wanted really to put this in place. Nursing homes do not have an infection control agent in place. If you don't have somebody that is in charge of infection control, how do you get training? How do you get protocol? And we're talking about pandemic. They need to have in place a structure, somebody that is just there to trace things like that. It might be COVID-19 now, but tomorrow it might be something. It can be TB, it can be other things that, are really affecting others. An infection control agent must be in place in every nursing facility as someone that the nurse can go to, as someone that can get the recommendation from CDC or other places, bringing into the facility and training the staff and testing the staff. That will prevent a lot of things from happening because that person will be just in charge of that department. It's a critical department, and that needs to be a requirement now for every single facility to be in practice.
Yeah, definitely. That's something that I guess healthcare advocates and workers on the front line can definitely advocate that their facilities have someone there like that. So great. So my final question that I see from the audience is, I think the viewer is asking, what is one thing you recommend, or what is one way you're dealing with stress now that you can recommend to them to try? Yeah.
I start already?
Yeah, go ahead.
Okay, so what I can recommend to them, first of all, they need to understand that this is a novel disease, is new. It has never infected the human race before. So we are all dealing with this at the same time. It's a pandemic. It started small in China, and now it's touched the 5 continents. So this is new. You are not by yourself in this. We are all facing the same stress at the same moment. You call your mother back home, you call your cousin in a village, everybody knows about COVID-19. So this should make you understand that we will get through this together, okay? This is the moment, and there have been a pandemic. Okay, did you file for unemployment? Do you have maybe some family members that can help give a hand for now until we get better? Did you call your credit card company to have them maybe, block the payment, reduce, the interest rate? Did you try to see with your student loan how we can have a deferment? Did you try, to check with your employer? Are they going to hire you when we get back together? Addressing all those stressors can help you address them better, right? Okay, second, you have food. You're not alone. Some family, so-called regular family, we used to have enough food. We used to be medium class. Now they go make the queue to try to get food from pantries, like Dr. Myers Association. I'm sure it sees some people who 2 months ago did not need it, but because of now, some households both lost the income, both food, as I say, providers have lost the income. There are some single home families who have lost that only income. Kids are at home, and we all know that kids can eat. They are home all day, the energy, and they need to eat. They will snack, they will breakfast, and all those things. We know some public school are still offering food every day, even on weekend. You go on Friday, you pick up the whole weekend. Food. They still offer food. Maybe you can look at those resources as well. You can humble down, call your local health department, call your local county. Every people have put in place so many resources to help them. You are not in this alone. There is nothing to be ashamed about, nothing to be worried about. The biggest CEO of the world have lost their jobs, okay? So humble down, lay on your bed, close your eyes, think about all what stresses you, and please write them down. Check, check, check. Don't be afraid to look for help, okay? Please, and you will be fine. We will all come together through this. Okay, thank you for being strong for me out there.
Thanks. Yeah.
I would say that we need to build our neural pathway for self-awareness and self-regulation through practice like mindfulness. This will help our nervous system regain balance, so it won't be just we'll be stuck in fight and flight or freeze response. It's important for us to be involved in self-stewardship prioritizing what nourishes our bodies, our minds, our spirits, and engaging resources that have supported us through ethical challenges before. We need to eat well, exercising. We need to connect with people, even virtually. We need to do not isolate, practice gratitude, and but you also ask for what you need. If you're hungry and you're not asking for what you need, nobody will give you the food. So you need to ask for what you need. You need to remind yourself and others that we will get through this. We will get through this. And self-care is more important today than ever. You cannot stay in the house being in front of TV all day long and just eating any type of food. You have to eat the food that will strengthen your immune system. So it's truly important for you to look at it as a journey, but we are all in it together. You are not alone. We will all make it. I'm sure that at the end of the day, the main thing is to being alive. If you are alive, you can fight. But if you neglect yourself and then you don't make it alive, I cannot go on the ground and grab you and save you. No, it's a team effort. As I'm doing my part as a nurse, you also as a patient, as a civilian, as someone that is in society, as in of someone, a person, a human being, you have to do your part. And it's now even kids being at home, you have to, in addition to your daily challenges, take care of the kids at the house, doing their homework. It's a new game for everybody. But what can we do? Look for the best in all of it. We will surely make it through. We've seen in the past different situations like this. People have risen up to the task and then made it through. Just stay in the game, stay in there, do your best, and the best is yet to come. It's not all lost. No, we are learning. It's a new game for everybody. It's a new journey for everybody. Like I always say at the beginning, it's the unprecedented position that we are in it, with high stake, where nurses have to make decisions that in the past they would not have made. In the past, when you come to the hospital, actually, what would you like to have? What service? What can we do for you? But now you don't have that option. You give the patient what you have, and sometimes in your heart you want to do more, but you can't. In society, at home, you want to eat something else, you might not have it. You do with what you have. You take what you have, you're grateful, you find different ways. You can go online and find resources and find a way to cook some healthy food. You can find a way to exercise at home using YouTube. It's free. You can find a way of talking to somebody on the computer, on WhatsApp. You can find a Cameroonian Nurse Association, for instance. We have a weekly meeting where we come together and share with each other on Zoom what were our challenges, what have we done, what are the strengths, what are the weaknesses, how can we come together, and we learn from each other. And that's really a place of also expressing our frustration. And by expressing it, you don't stop blame. And one of the things that I'm really concerned with is that after this, we will have a high level of post-traumatic stress disorder in people. And we have to deal with that. Dealing with people with issues of losing family members, losing a job, are lost. Dealing with all that and not knowing how to cope, that creates a mental health need in high level than in the past. So we have to work together.
Definitely, we do have to work together. And some of those things you're bringing up, we've actually had a series of discussions on them. But we know that we are in good hands because of wonderful frontline healthcare workers and work heroes like you are. So we really appreciate you coming on. We really appreciate your passion. We appreciate your humility for serving and caring for the community like the way you're doing, and doing it during these very unprecedented times in such a humble and grateful way that it's really amazing. So thank you all so much for coming on to share your experiences. And I guess before we end the show, do you all have any final words for our viewers?
Take care of yourself.
Thank you, Dr. Manka. Thank you so much for doing this. And I hope you take care of yourself as well. because you have as a big role as we are, because you are, trying to, connect people together, which is paramount in this time. And you also, giving us a platform to talk and to exchange. And you also, allowing more community education. So we thank you. I want to thank you. Please take care of yourself as well. We need you. And
thank you.
Everybody, take care of yourself. Aurélie, thank you so much for your hard work. Really appreciate
you. It was a pleasure.
All the nursing home in my county have an outbreak right now.
Thank you.
And our best friend, infection control preventionists, they make a difference because now they get you what you need and they make a big difference in the structure. So what you said exactly touches me because I know what you're talking about. And so that is a very good point. So thank you so much for everything you do. And Dr. Manka, thank you. God bless you. Until we meet again.
Well, thank you both. Thank you both.
Thank you so much, everybody. Thank you, Dr. Mayor, also for all what he does for the community, for the food. That is paramount. I already say, a closed mouth don't get a closed mouth. If you close your mouth, you don't get fed. So you open your mouth to tell people that you need it or to go to the drive-through so you can get food. So please, humble down, go get food so you can feed yourself and your family and stay fit. Okay?
Yes. Well, you've heard our panelists. We really, really appreciate you all coming. And we've reached the end of our show, so I want to thank our guests. We had Mr. Mayor Moody with American Diversity Group, who are providing, in addition to healthcare and dental care, they're providing food and groceries, and they have their next session of Grab and Goes on Saturday in Montgomery County. So please check our website for that information. We want to thank you, Dr. Konate and Nurse Aurélie, for really sharing your experiences and sharing your passion. It's amazing how passionate you are about the work that you do and caring for us and our community and having your lives change because of the way you want to care for the community. We really appreciate you all and thank you all so much.
Thank you.
Thank you. Thank you.
Thank you.
Thank you.
So thank you too to our viewers for tuning in tonight. We hope you all can join us again for our next discussion. We'll let you know. Check out our website and our Facebook page for future discussions. And now we're going to hand over to Alan in the studios.
Wow, very great conversation. It was very great conversation. Thank you so much, Dr. Manka. Thank you, everyone. Thank you, all the guests today. And it was Afriquetoday. Thank you, African Community Service, Immigrant Community Service, to set up this town hall show for us. Okay, you're watching Afriquetoday, and you can watch Afriquetoday live on 4 platforms: Facebook, YouTube, Twitter, also our website www.afriquetoday.com. Please download Afriquetoday app and you will be able to watch us everywhere. Okay, see you maybe next time. Have a good evening.
Salut à tous et bienvenue dans cette nouvelle émission de Transformation Point avec Salvation of Christ sur Afriquetoday. Nous vivons une époque où nous voyons les choses qui n'ont pas existé des siècles et des siècles avant nous. Une époque douloureuse, incertaine, pleine de dépression et d'incertitude. Nous vivons au milieu des cris et des larmes. Nous devons être compatissants avec tous nos semblables qui souffrent dans le monde. Nous devons prier pour la guérison, pour le secours et le salut du monde entier. La bonne nouvelle, mes bien-aimés, c'est que Dieu est toujours sur son trône. Il est au contrôle parfait de tout ce qui se passe en bien ou en mal. Beaucoup de personnes se posent des questions. Est-ce que Dieu est encore au contrôle? Pourquoi laisse-t-il autant de mal frapper l'humanité qu'il aime bien? Nous allons répondre aujourd'hui dans Transformation Point. Devant les situations où nous avons le cœur profondément troublé, comme celle de la pandémie, présentée qui ne cesse de s'accroître, la parole de Dieu nous exhorte à nous revêtir de paix que nous avons dans la bonne nouvelle de la connaissance du Seigneur Jésus-Christ qui nous aime et qui nous donne le salut éternel. Tout autour de nous, ce sont des mauvaises nouvelles que nous avons. La parole de Dieu est pleine de paroles d'assurance et d'espérance. Elle est la bonne nouvelle de la part du Seigneur Jésus-Christ qui dit dans Jean 14, 27, « Je vous laisse la paix, je vous donne ma paix. Je ne vous donne pas comme le monde donne, que votre cœur ne se trouble point et ne s'alarme point. » Quelles que soient les situations que le monde va traverser, que ce soit les insécurités, les agressions, les crimes, les persécutions, les maladies de toutes sortes, d'abominations, de catastrophes, de guerres, de difficultés énormes et de tragédies, de morts atroces, de destruction qui nous apportent beaucoup de peur, d'inquiétude et de tourments et de dépression, le Seigneur Jésus-Christ sera toujours présent pour nous donner sa paix qui surpasse toute intelligence. Il n'est pas du tout possible de vivre une vie paisible et stable si nous n'avons pas nos cœurs baignés et solidement enracinés dans la parole du Seigneur, qui est un antidote contre tout. Sincèrement, nous ne pouvons pas être heureux si nous n'avons pas la paix dans le cœur et dans l'âme. Nous devons rechercher et poursuivre la paix qui se trouve dans la parole de Dieu. Tout ce que nous trouvons ailleurs nous donne une paix éphémère et momentanée qui ensuite nous plonge dans une situation initiale de désespoir. Seul Jésus-Christ donne la véritable paix et nous devons marcher avec lui et le laisser guider nos vies dans la paix. Comme Psaume 4, 9 dit, « Je me couche et je m'endors en paix, car toi seul, ô Éternel, tu me donnes la sécurité dans ma demeure. » Bien-aimé, le Seigneur seul nous garantit la sécurité. Pendant que nous sommes actifs, nos vies sont constamment exposées aux différents dangers, surtout maintenant avec cette pandémie. Si nous sommes encore en vie, c'est grâce à la bénédiction de notre Dieu. Nous restons en prière et nous rendons grâce au Seigneur en tout temps et en tout lieu. Il nous donne la promesse de nous garder de tout mal. Il nous demande d'avoir confiance en lui. Comme Philippiens 4, 7 dit, « Et la paix de Dieu qui surpasse toute intelligence gardera vos cœurs et vos pensées en Jésus-Christ. » Dieu est celui qui nous garde et qui nous bénit. Il nous accompagne partout où nous allons et en tout temps. À toi particulièrement, bien-aimé, voici la promesse que Dieu te donne aujourd'hui dans Psaume 121, 5 et 7. « L'Éternel est celui qui te garde, l'Éternel est ton ombre à ta main droite, l'Éternel te gardera de tout mal, il gardera ton âme, il gardera ton départ et ton arrivée dès maintenant et à jamais. » Aie confiance en lui et garde cette promesse devant les situations de détresse. Appuie-toi sur elle et elle te rassurera et te donnera le réconfort, la paix, la joie et te remplira d'amour de Dieu. Prie avec moi. Merci Seigneur de me donner ta paix qui surpasse toute intelligence dans ce monde plein d'insécurité. Quand j'ai le cœur troublé par les problèmes de la vie et l'âme déchirée par les souffrances interminables et traumatisée par les circonstances tristes, tu me consoles, tu me protèges et tu me rassures que je suis inébranlable entre tes mains. À qui d'autre irais-je si ce n'est à toi, Seigneur? Tu as les paroles de la vie éternelle. C'est toi qui me secours et qui me garantis la vie et le salut par la puissance de ton Esprit Saint, au nom de Jésus-Christ notre Seigneur et Sauveur. Amen. Pendant que nous continuons à parler des difficultés, du mal et des souffrances, il est très important que nous sachions l'origine du mal, la position de Dieu et sa réponse à la condition humaine, destinée à confronter le mal et la souffrance dans le monde. Pourquoi donc le mal? Pourquoi la souffrance? Quelle est la réponse de Dieu devant la souffrance humaine qui va grandissante? Quelle est la réponse de Dieu devant le Covid-19? Le mal et la souffrance sont la résultante de la désobéissance de l'homme à Dieu. Au début de la création, nous voyons un Dieu plein d'amour qui crée l'homme et la femme libres de faire des choix et les met dans le jardin d'Éden, un environnement parfait de joie et de bonheur avec un ordre. Dans Genèse 2, 16 à 17, l'Éternel Dieu donna cet ordre à l'homme: tu pourras manger de tous les arbres du jardin, mais tu ne mangeras pas de l'arbre de la connaissance du bien et du mal, car le jour où tu en mangeras, tu mourras. Par la suite, nous voyons un nouveau personnage, un ennemi mortel, le diable qui entre en jeu avec le mal et qui séduit l'homme et la femme, qui finalement cède au péché, ce qui amène donc Dieu à prononcer la sentence douloureuse de condamnation comme suit. Dans Genèse 3, 16, 19, il dit à la femme: j'augmenterai la souffrance de tes grossesses, tu enfanteras avec douleur et tes désirs se porteront vers ton mari, mais il dominera sur toi. Il dit à l'homme: puisque tu as écouté la voix de ta femme, et que tu as mangé de l'arbre au sujet duquel je t'avais donné cet ordre, tu n'en mangeras point, le sol sera maudit à cause de toi. C'est à force de peine que tu tireras ta nourriture tous les jours de ta vie. Il te produira des épines et des ronces, et tu mangeras de l'herbe des champs. C'est à la sueur de ton visage que tu mangeras du pain, jusqu'à ce que tu retournes dans la terre d'où tu as été pris, car tu es poussière et tu retourneras dans la poussière. Bien-aimés, voici donc l'origine du mal et la souffrance dans laquelle nous sommes retrouvés et qui continue à s'empirer dans le monde aujourd'hui. Romains 1, 21 dit: puisque ayant connu Dieu, ils ne l'ont point glorifié comme Dieu et ne lui ont point rendu grâce, mais ils se sont égarés dans leurs pensées et leur cœur sans intelligence a été plongé dans les ténèbres. Le péché et les conséquences du péché, bien-aimés, continuent à croître aujourd'hui quand nous refusons d'écouter Dieu. Les crimes, les violences, les sectes et tout genre d'abomination, aujourd'hui, ce que le monde subit est la conséquence du mal. Tout le monde connaît maintenant que le Covid-19 est la résultante de la manipulation du virus au laboratoire. Des millions de personnes sont infectées, des milliers de gens meurent et les activités paralysées. Bien-aimés, tous les ordres, les commandements et les exhortations que Dieu nous donne l'ont toujours été par amour pour nous et pour notre bien et pour notre protection. Et nous nous détruisons énormément et souffrons si nous ne l'écoutons pas. Quand nous n'écoutons pas les paroles de Dieu, nous nous détruisons et nous détruisons ceux qui nous entourent. Nos péchés nous affectent, mais ils affectent également les innocents qui nous entourent. Quelle est donc la réponse de Dieu devant la souffrance humaine qui va grandissant? Quelle est la réponse de Dieu face au Covid-19? 1 Timothée 2, 3, 4 dit: cela est bon et agréable devant Dieu notre Sauveur, qui veut que tous les hommes soient sauvés et parviennent à la connaissance de la vérité. La réponse de Dieu est que tout le monde connaisse son Fils unique Jésus-Christ pour être sauvé. Dieu a envoyé son Fils unique dans le monde pour nous sauver, comme on le lit dans Jean 3, 16, car Dieu a tant aimé le monde qu'il a donné son Fils unique, afin que quiconque croit en lui ne périsse point, mais qu'il ait la vie éternelle. Connaître la vérité, bien-aimée, c'est comprendre que sans Jésus-Christ dans nos vies, sans l'écoute et la mise en pratique de ses paroles, nous sommes sur le chemin de la destruction. La réponse de Dieu a donc été toujours de se repentir du mal et de marcher sur le droit chemin. Jésus-Christ est le chemin, la vérité et la vie, et nul ne peut être sauvé de la destruction du monde et de l'enfer sans passer par lui. Prions Dieu. Merci Seigneur parce que tu es le même hier, aujourd'hui et éternellement. De la même manière que tu as donné des avertissements à Adam et Ève et tous ceux qui ont précédé, tu nous donnes également des avertissements aujourd'hui. Et c'est en guise de protection et d'amour que tu nous donnes des recommandations et tes commandements. C'est pour nous sauver de la destruction de nos vies et bien plus de la condamnation éternelle. Ô Père céleste, préserve-nous de toute chute, sauve le monde en péril dans cette pandémie. Nous nous repentons du fond du cœur dans l'espérance, Seigneur, que tu vas nous apporter la guérison, le salut, le secours et surtout ton amour. Nous voulons te suivre, te servir, te louer, t'obéir et t'adorer éternellement au nom de Jésus-Christ, notre Seigneur et Sauveur. Amen. Nous voici donc à la fin de Transformation Point avec Salvation of Christ sur Afriquetoday. Nous avons bien écouté le Seigneur Jésus-Christ nous dire dans Jean 16, 33b, « Vous aurez des tribulations dans le monde, mais prenez courage, j'ai vaincu le monde. » Le Seigneur Jésus-Christ est le seul qui a pu vaincre le monde. Il a vaincu la mort. Nous pouvons lui faire confiance et marcher dans une relation personnelle avec lui en écoutant ses paroles, en lui obéissant, et il nous délivrera de tout ce qui nous tourmente et nous tracasse. Ouvrons grandement nos mains pour recevoir la bénédiction de Dieu. Que le Seigneur vous bénisse et qu'il vous garde. Que le Seigneur fasse lui sa face sur vous et qu'il vous accorde sa grâce. Allez dans son amour, allez dans sa paix, allez dans sa force, allez dans son assurance et passez une agréable semaine et à dimanche prochain dans une nouvelle émission de Transformation Point avec Salvation.